The attempted murder of Virginia State Senator Creigh Deeds by his son Austin is focusing new light on mental health care in the United States. The father and son were said to be close by most accounts, but the 24-year-old had undergone a psychiatric evaluation on Monday, but reportedly he was not admitted to a hospital because no bed was available. There is a growing shortage of mental health beds across the country. According to the Treatment Advocacy Center, there are almost 5,000 fewer beds than in 2009. Because of psychiatric hospital closings. For more on the issues of vanishing beds, joining us on the phone from Arlington, Virginia, is Ron Honberg, the Policy and Legal Director for the National Alliance on Mental Illness. Welcome to Arise America, Ron.
Thank you.
Give me an assessment of how you think we as a society today regard mental illness and the mentally ill.
You know, unfortunately, we still have a ways to go in recognizing mental illness as mental illnesses as real, and in putting the same kind of resources and focus on treatment to mental illnesses that we do for other medical illnesses like heart disease, cancer, etc. In recent years, particularly with the budget crisis that existed in America, we've made significant cuts to the mental health system that have led to both elimination or closure of psychiatric hospitals and also fewer community services for people. So oftentimes folks don't have any treatment available to them until their situations become emergencies or crises.
You know, we could go down a long list of previous tragic incidents that can be related to an individual battling mental illness, whether it is Austin Deeds or the shooter at the Washington Naval Yard, Adam Lanza, and the list can go on and on. So I know that they're all very different situations, but in a general global way, what needs to be done to catch people like this that are struggling with mental illness before a tragedy happens?
Well, let me first of all say that most people with mental illnesses are not violent. And while we hear about these horrendous tragedies that do involve violence, and they seem to be happening a lot, they in fact don't happen that often. I mean, certainly the data that's been collected, the studies that have been done, show that most people with mental illnesses are more oftentimes the victims of violence than the perpetrators of violence. So I always try to remind folks of that when these tragedies do occur. But having said that, what we really need to do is create a mental health system that is more like the healthcare system for other diseases. So, I've always described the mental health system as a downstream system. You really oftentimes can't get help until you are in, your circumstances are an emergency. So in many parts of the country, people can't even voluntarily check themselves into hospitals if they feel they need that level of care. They literally have to deteriorate to the point that they meet the criteria for involuntary commitment, which is dangerousness to self or others, before they can get help. So we need to put more resources into early identification and intervention. We need to put more resources into better coordinating inpatient care with community care. Certainly, all states could take a significant step forward by expanding their Medicaid programs. That would put a lot more resources into community services and free up psychiatric hospital beds for those who need them the most. And we also need to figure out a way to streamline commitment processes so that people can get timely treatment when they need it. This situation in Virginia, frankly, illustrates more than anything else the poor coordination and the lack of effective communication that occurs so often when people need inpatient treatment. So we're getting conflicting stories. We heard from the local Community Service Board, which was responsible for finding a bed for Mr. Deeds, that there were no beds available. That's why they released him. We're hearing on the other hand from local hospitals that they in fact did have beds available, but they were never contacted. I don't know what the truth is. What I do know is that there apparently was very poor coordination and communication, and this involved the son of a senator, a very powerful state senator. So you can imagine the kind of challenges that people with mental illnesses who don't have powerful family members like that encounter in trying to get help.
Absolutely. Well, this dialogue certainly needs to continue. We'll have to stop it right now, though. Ron Honberg, thank you so much for your time.
My pleasure. Thank you.